Hello students, today I'll be discussing on the charts based on calcium and rickets. Till now you have already got an idea that these charts will be given to you in your Viva bus, and some of these may be based on calcium and rickets. So you need to have a clear concept, a clear picture about it. Now, before going to the chart proper, let us have a general review on calcium. What is calcium? Calcium is a macro mineral that is required more than 100 mg per day. What is the content? Total content of calcium in the body. So 1 to 1.5 kgs you'll find calcium is present in the body. Where is it? Mainly in the bones and only 1% in the extracellular fluid. What are the sources of calcium? Mainly milk is a very good source. Besides this, we are having egg, fish, vegetables, and many other foods where we find, that is even in the cereal, some amount of calcium we find. What is the daily requirement? Now the daily requirement in general in adults it is 500 mg per day, and in a child it is 1200 mg per day. Now in certain conditions you'll find that the requirement is more, like in pregnancy and lactation, or in age-old persons more than 50 years of age, you'll find the requirement is more, that is 1500 mg per day has to be provided to these people. Now the reference range means the normal value. What is the normal value? It is 9 to 11 mg per deciliter. It will be also expressed in milli-equivalent per liter. So if you consider milli-equivalent, it is 4 to 6 milli-equivalent per liter is the normal value. Regarding sample, it is a serum which we collect for estimating the calcium. Now the total calcium can be evaluated at the same time the ionic form. But remember that the active form of calcium is definitely the ionized form. Absorption. First is, what is the site of absorption of calcium? So it is the first and second part of duodenum. And how does it occur? The mechanism, it is absorbed against a concentration gradient. That means requiring energy. Along with that, it also requires a carrier protein that is helped by calcium dependent ATPase. Now, the factors which are increasing or decreasing the absorption of calcium. The most important factor is vitamin D. So, the factors which are increasing the calcium absorption is vitamin D. So, vitamin D, how does it increase? It is going to enhance the synthesis of a protein which binds to calcium while absorption. That is cal binding. How does it do so? Vitamin D is going to go and bind to the nuclear receptor, and then this receptor complex together goes, it attaches to the DNA, it will increase the transcription and finally enhance the gene expression. That is, the protein synthesis is increased, particularly of this cal binding. There are other factors also, like a hormone, parathyroid hormone. It is going to increase the absorption. How? Because it will increase the calcium transport from the intestinal cells. Besides this, there are other factors like acidity and amino acids, particularly basic amino acids, which increase the absorption of calcium. Now, coming to the factors which are decreasing the absorption, there are certain substances like phytic acid, oxalates, in case of fat malabsorption, and phosphates also at times. They form some insoluble salts with the calcium and thereby preventing its absorption. Now, calcium influx and efflux in cells. How does it occur? Now, the influx mainly occurs by sodium-calcium exchange mechanism. That's sometimes in mitochondria also by the uniport system. But the efflux definitely occurs by sodium-calcium antiport system. This is dependent on a pump, that is a calcium pump, or sodium proton ATPase pump. Besides this, there are other calcium operated channels like the voltage gated operated channels or second messenger operated channels. Coming to the functions of calcium. The very first function is calcium causes the activation of many enzymes. One very good example is calmodulin, which is a protein which binds with calcium ions. Thereby, what it will do? It will activate some particular enzymes like kinases, protein kinase, etc. This enzyme further, it will activate the phosphorylated form of the enzyme, finally having the biological effect. Particularly through G protein, etc. it is going to work. Now, in some cases, you'll find the enzymes are directly activated by calcium, like that of pancreatic lipase, enzymes of coagulation pathway, etc. Second function is that calcium causes the excitation contraction of muscles. Now, what will happen? Because of the neuronal signal, the calcium is released from the sarcoplasmic reticulum. Okay, it moves out. Calcium activates the ATPase and increases the action of actin and myosin, thereby facilitates contraction. So the main thing here is calcium has to interact with the troponin C, and finally the contraction occurs. So calcium decreases the neuromuscular irritability. The third function is nerve conduction. It helps in the transmission of nerve impulses. Then other functions are there like secretion of hormones, like insulin secretion is increased. Then parathyroid hormone secretion, this depends on calcium. That means calcium level when it's less, so parathyroid secretion is higher. Again, calcitonin. This hormone again, it will increase if suppose the calcium level is very high, then the calcitonin will be on the rise to reduce the calcium level, etc. Then it also acts as a second messenger system, and finally in the coagulation, it itself is a factor in the coagulation. So we come to a very particular manifestation of vitamin D deficiency in children, that is rickets. So the cause of it I already mentioned. So it is due to vitamin D deficiency seen in children. Why? Because vitamin D is very important for calcium absorption to maintain the calcium homeostasis, as I mentioned before. So if calcium is less, the calcium is less, and then there is no deposition in the organic matrix of bone, there is no mineralization, and so the bones become very much weakened, thereby leading to manifestation that is rickets. There are ample amount of bone deformities which you find in rickets. Here what will happen? The bones become soft and pliable. The bone growth is very, very markedly affected. We get very, like in laboratory findings, there will be very less calcium level, also phosphate, and certain enzyme, that is the ALP, alkaline phosphatase, is much raised. Okay, and the clinical features what you will find, there will be bow legs, the knock knees, rickety rosary. Rickety rosary is the prominence of the costochondral junction. Then there will be bossing of frontal bones, Pigeon chest, Harrison sulcus. So it's a sulcus, a depression which you find just above the subcostal margin. So I'll show some of the pictures in the next few slides. Types. So what are the type of rickets? There are main 4 types you can remember. First is vitamin D dependent rickets. So the vitamin D dependent rickets may be of 2 types, 1 and 2. This is A and B. A is your 1 and B is your 2. So the first type is what? Where there is a deficient vitamin D. Maybe the intake is very less, or the production, synthesis is very less, exposure to sunlight is very less. So due to which you are getting less vitamin D. So there is less calcium and phosphate, less mineralization. The second one, vitamin D dependent rickets type 2, where you are getting, mainly it is because of the receptor defect, or the response is not proper. That is, the vitamin D mainly acts through the nuclear binding receptor mechanism. If suppose vitamin D amount is enough in your body, but it does not produce its effect because it cannot go and bind properly with the receptor. The receptor is defective. So in such cases, the functions cannot be carried out and leads to low mineralization. The third is vitamin D resistant rickets. So this is mainly because of the decreased phosphate. It may be due to any reasons, hypophosphatemic rickets, maybe because of Fanconi syndrome, where you are getting not only phosphate, along with phosphate some other substances like bicarbonate, glucose, amino acids, these are also deficient. Or it may be because of some mesenchymal tumors where you are finding the phosphate is very less. Okay, it is excreted out. Then finally we are having renal rickets. Maybe some kidney disorders are there due to which the active form of vitamin D is not present. So thereby what happens? It results in rickets. The laboratory findings I already mentioned before. Along with the clinical symptoms, you have to keep an eye. You have to keep a watch on the phosphate level, calcium level, alkaline phosphatase. Sometimes you are provided with the vitamin D level and parathyroid hormone. Okay, so because the calcium is very less, vitamin D is less, so the calcium will be less, low value. And then because the calcium is less, so the parathyroid hormone, as a feedback, it is going to increase. Treatment, what we are giving. See, the normal level which we require for vitamin D, it is 100 to 400 units per liter in children. And in adults, it is 200 units. But in case of rickets, we require to give at least 600,000 international units. Okay, it may be given stat dose, single dose, or it may be given in 2 to 3 months dose, divided dose. Okay, if you are giving in divided dose, 500 to 10,000 units has to be given, and that too in divided doses per day. Now these are the manifestations being shown in pictures. This is the frontal bossing, which you can see the head here becomes square shaped. Over here we can see the Harrison sulcus, as well as we can see the rickety rosary. You can see the prominent nodding of this costochondral junction. This costochondral junction, this becomes very much prominent. The Harrison sulcus. This is a pod-bellied as well as PGN chest. You may also find some other deformities like there is kyphosis, forward bending or backward bending, kyphosis, scoliosis and lordosis. So there is lateral bending also. This is the bow legs, which is also said to be genu varum. This is widening of wrist. This is a widening of ankles. So these are some deformities which you are getting. Now the first picture is showing you what is knock knees. So it is also called the genu valgum. While the child starts to run, what happens? He falls down because the knees are knocked. You will see in the next picture there is cupping and fraying of the distal radius and ulna. Because of the demineralization, very poor mineralization. Also you will find around the epiphysis, you will find very poor mineralization occurs. So the diaphyseal as well as epiphyseal bones, you will find fraying. And finally, this is the picture where you find bending of long bones because of the same reasons. Now coming to the charts on calcium and rickets. First question, a 6-year-old child was brought to the hospital with complaints of slow growth and pain in the bones. So the bone growth is very less. On examination, he was anemic, had frontal bossing, bowing of legs, swelling of costochondral junction. Laboratory results showed serum calcium 8.2, phosphorus is 2.8, serum ALP 720. What is the likely diagnosis? So it is already understood. It is rickets. Why? Because the bone growth less. Anemic. See, the vitamin D also has got an effect on the immunohematopoietic system. That is, it is going to inhibit the B lymphocytes, T lymphocytes, the precursor monocytes, all cells. So due to which this presentation is there. Frontal bossing is another feature. Bowing of legs, swelling of costochondral. What is this? rickety rosary. And finally, the laboratory result shows you, isn't it? The phosphorus is less, calcium is less. Phosphorus normal level is 3.5 to 5.5. So this is decreased. ALP is much higher, 720, where we consider up to 350 to 400 is your normal. So it's much raised. So here you'll be asked, then what will you do? You'll provide the calcium. It may be oral calcium or it may be IM. Then what further can you see? Vitamin D level, you have to see parathyroid hormone. These are for confirmations. You can see whether it is typically rickets or not. Okay. Then a 4-year-old boy was brought to the pediatric OPD with the complaints of mild convulsion about 1 hour back. There was no fever or loss of consciousness, frothing from mouth. Okay, so neurological symptom as such is not present, mild convulsion, that is irritability. He also gave history of started walking late, around 2 years of birth. On examination, child's growth was retarded and looked ill and malnourished. Limbs had poor muscle tone. His legs looked bowed, so bowing of legs is there, knock, knees is there, abdomen was protruded. So the clinical symptoms shows a picture of rickets. So here you find the neuromuscular irritability is there. Further, what will you go for? Definitely confirmation by the calcium level, phosphorus level, vitamin D, parathyroid and ALP. These are the laboratory findings which you'll search for in this patient. Next. Number 3, a 9-year-old girl presented with muscle pain, cramps, tingling of hands, feet, stiffness, recurrent carpopedal spasm, and tetanic posturing of both hands and feet. She was a strict vegetarian with no milk or milk products. On examination, no symptom of rickets. BP was normal, Trogius sign positive, calcium is 6.5 mg per deciliter. So here typically we are finding carpopedal spasm, muscle pain is there, tingling is there, and no milk or milk products. That means the source is gone. So BP normal, Trogius sign positive. This is a typical sign for tetany. Calcium level, see, it's low. So the diagnosis is proved. Number 4, a 54-year-old grossly overweight woman presented with complaints of cramps and spasm of both hands. She was depressed and had positive Trogius sign and Schuster's sign. Past medical history revealed thyroidectomy for Graves' disease. So, did you get this? Surgical removal of thyroid or parathyroid glands. So, it was removed. Now, the laboratory result showed creatinine is 1, serum calcium 4.1, this is decreased, phosphatus 5.9, this is higher, ALP is 60, okay, normal, albumin is 4 gram percentage, that is also normal. So, typically what you find, these two signs are positive. Surgical removal of thyroid, okay. So, as a result, what will happen? The thyroid hormone secretion is less. So, the person is overweight, manifesting. And the person is having tetany. That is carpopedal spasm also definitely. They have not mentioned here. So, cramps and spasms they are having. Okay. So, it is proved it is tetany. Now, the fifth one is a very typical. Okay. So these are the charts which I have mentioned for calcium and rickets. So, try to understand, go through these. These are very important. Thank you.